In today's video, I'd like to talk about fear and non-adherence. And fear is an extremely common emotion together with anxiety found in many people and patients. And it's something that we as doctors need to be aware of. And we also need to be aware of the things that people are afraid of. And this video is going to be short and just give you an overview of the things to keep in mind, things that people commonly fear. And maybe you can add to this list afterwards, and I'd love to hear from you in the comments below if you can think of any other fears. But let's just quickly go through some of the common ones. Well, I think firstly, if a patient is diagnosed with a disease for the first time, there's a huge fear of the unknown, because so many things they don't know yet. They don't know much about the disease, they don't know much about the treatment, whether it will work or not, whether it will have any value. They don't know what the prognosis necessarily is going to be, or what will happen if they do not respond to therapy anymore. And these things certainly create anxiety in people. Now, together with that, there's of course the fears related to the disease, especially if it's a chronic disease or a serious disease, such as an advanced cancer or a disease that will have a great impact on your lifestyle. These things may lead to problems in coping with the adjustment to the new diagnosis, may even lead to denial. In some diseases like HIV, for instance, there is a strong fear of rejection, and we see this with adolescents and in some communities where people are afraid that they will be rejected by friends or family. So they will often try to hide their medicine or even not take their medicine because they are afraid that they will be exposed. We can think of fears related to the treatment. So if we think of the treatment, there's lots of fears. Some people would tell you, I'm afraid of taking pills, I'm afraid of injections, afraid of needles. Let's just write needles there because that's a big one. They may say, I'm afraid of the side effects. And interestingly enough, some studies have shown that this is one of the greatest needs that patients have, is to actually be told what the side effects are that they should expect, and if they occur, what they should do. So think about this. Don't avoid the topic of side effects. Of course, there are other fears related to the treatment. Losing your looks, maybe hair loss in patients getting chemotherapy, or losing your fertility, which is also a possibility with certain types of treatments. How will it affect my sexuality? Maybe a question that a patient thinks but is afraid to ask. Then there's also things related to following the disease. Let's just say follow-up. Let's say the patient is afraid of doctors, or they are afraid of hospitals. That could be a big challenge. What about a patient who is afraid of being in a small spaces, claustrophobia? Some diseases require follow-up with MRI or CT scan, and these small spaces could be very difficult for some patients to negotiate. Then there are the fears that we don't necessarily think about, but these are fears related to finances. And people have concerns, and these things they also often do not mention to their doctors, but it was also shown in one study to be one of the top 3 things that patients want their doctors to talk about is, will I be able to afford the medicine? How much of a burden will this disease and its therapy and its monitoring be on my financial situation and on my family? So we need to be aware of this. Of course, there are the more common and general fears related to pain or suffering, and of course the fear of death. And we should not avoid these issues. We should really engage with our patients and talk to them. Open communication, a good doctor-patient relationship creates the environment in which one can address these things head on and speak openly about them. And I really think that if we are able to allay our patients' fears in person, or sometimes by giving them written materials that can reassure them, we can go a long way in ensuring that they will also be adherent and compliant to their therapies.